This is COVID-19, not COVID-1, folks.
So tonight, this is from Kellyanne Conway. This is a breaking news. Tonight, I tested positive for the COVID-19. My symptoms are mild, light cough, and I'm feeling fine. I have begun a quarantine process in consultation with physicians. As always, my heart is with everyone affected by this global pandemic. I was watching the video of this Rose Garden event, Dr. Gupta, and I saw all of those. There's Kellyanne Conway. All those people sitting there, no masks, no social distancing. And now we have several people, members of our government, if not elected officials, advisors to the president, all sitting there, including the Attorney General of the United States, the Chief of Staff, Tom Tillis, who's now tested positive. He is wearing a mask, by the way, though. And Kellyanne Conway, now the breaking news, has tested positive for COVID-19. What is going on, Sanjay?
Well, I mean, first of all, I feel for her, you know, and all the people who are newly diagnosed. I mean, just having talked to so many people who received that diagnosis, it kind of, you know, it's jarring for people, you know, because it suddenly makes it very real. And, you know, statistically, chances are people are going to recover and be okay. But it is very jarring. But I think, Don, to your point, I think we're starting to be able to describe this as a potential super spreader event that occurred. I mean, it was outside, which is beneficial, but as you mentioned, people unmasked within 6 feet, closely clustered for long periods of time. So there were a lot of people who had close contact with each other there. We don't know if there was a person that was a particular super spreader, or if there were several people there, but it's sounding more and more like that's where many of these people maybe had that first exposure. Now, you know, we know with the president, you know, the contact tracing is always the key then, right? Can you trace people, hopefully find their contacts and quarantine them? It can be really hard because people, if they didn't get tested, they don't know. They could have been spreading for a long time. With the president, if he develops symptoms on Thursday, it's usually the few days before you develop symptoms where you're the most contagious. During that time, you know, the president traveled to 5 states. He was in Washington. You know, he came in contact with lots and lots of people. It becomes really challenging. But that event that you're looking at is increasingly sounding like a super spreader event. We haven't said that very often, Don, because it's just so hard to do contact tracing in this country. When you have 40,000 new infections a day, it's a laborious task to do contact tracing. But this one's becoming clearer.
I want to thank everybody for the tremendous support. I'm going to Walter Reed Hospital. I think I'm doing very well, but we're going to make sure that things work out. The First Lady is doing very well. So thank you very much. I appreciate it. I will never forget it. Thank you.
It's killed more than 30,000 Americans, and you know why it's called COVID-19? Because it was identified in China in December of 2019. It's not the 19th version, again, as I said, of the coronavirus. Those are the facts. But Kellyanne Conway doesn't seem to have gotten the memo.
This is COVID-19, not COVID-1, folks. And so you would think the people charged with the World Health Organization facts and figures would be on top of that.
She is a senior counselor to the president, one of the people who's supposed to be advising him on this deadly crisis. Should be on top of the fact that the novel coronavirus, novel meaning new, by the way, that it emerged in 2019. So it is a new virus, not the 19th version of anything. And it emerged in 2019. You would think that she would know that.
This is COVID-19, not COVID-1, folks.